I'm Bruce Vanderhoff, Director of the Ohio Department of Health. I want to thank you again for joining us here today. As you've heard over the past few days, adult and children's hospitals statewide have been sounding the alarm. The current surge in COVID-19 hospitalizations is putting a dangerous strain on the state's healthcare infrastructure. And while healthcare in Ohio remains very safe, with providers working every day to protect patients and caregivers, we're in a serious situation. Hospitals are being stretched toward capacity, not only because of the high numbers of COVID-19 hospitalizations, but also as a result of staffing challenges, particularly among the dedicated healthcare workers who have been fighting this virus on the front lines day in, day out for more than 18 months. Hospitals are having to make difficult decisions and implement plans that alleviate that pressure on their systems and their staff. Some have had to reschedule elective procedures. Some have diverted patients to other hospitals or have implemented patient visitation policies. And as we've heard, some have temporarily even reached their full capacity. When we hear about these necessary responses, it should raise some alarm, as none of us want our hospitals to get so busy that there isn't a bed for you in the hospital if you need it. Of course, despite how busy our hospitals are, if anyone has a health emergency, they're suffering symptoms of a stroke or are in a car accident, they should, of course, not hesitate at all and should call 911 to seek emergency medical treatment. However, if you have mild routine health concerns, you're encouraged to evaluate your symptoms and call your provider to discuss your healthcare needs. You might also consider whether a telehealth provider might be able to help diagnose and treat you. What about a nearby urgent care center or clinic inside of a pharmacy or grocery store? And if you still need to go to the emergency room, please do. But recognize the wait may be significantly longer than usual. And if you're experiencing symptoms of COVID-19, you should really think about calling ahead to your provider, your urgent care center or hospital, to discuss if in-person medical evaluation is needed. If you think you might have COVID-19 with fairly mild symptoms, providers might also point you in the direction of COVID-19 testing, which is available at many pharmacies, libraries, and community providers statewide. Ohio hospitals are working collaboratively with other providers and state agencies to ensure communities continue to have access to needed healthcare services. Ohio's hospitals and the Department of Health maintain a robust regional zone structure to assure robust and timely resource management, communication, and emergency response throughout our state. Ohio's trauma network has been in place for years to help divert patients as needed to other nearby hospitals to receive necessary care when needed. Hospitals run preparedness drills and testing and put those plans into action. If you need medical care, rest assured, Ohio's healthcare system is responding to ensure you get what you need. But as I said earlier, we are facing a challenging situation. So the best thing we can do to alleviate the pressure on hospitals is to choose to be vaccinated and wear a mask when advised. Remember, the lion's share of those who are hospitalized with COVID-19 remains those who are unvaccinated. As we've discussed in previous weeks, we continue to see our surge amidst the Delta wave drive cases and hospitalizations ever higher. Yesterday, we reported over 7,000 cases from the previous 24 hours, taking our 21-day reported case average above 6,000. And in that same 24-hour period, it was reported that 292 Ohioans were admitted to the hospital. Now, I think it's important to compare this information to previous times in the pandemic. So last year, on that same day, September 15th, the 24-hour reported change in cases was just over 1,000, with 103 new hospital admissions. So as you can see, from 1 year ago today, even though about half of us today are well protected by vaccination, our daily hospitalizations are about triple what they were last year. And the reason is simple. The Delta variant is aggressively seeking out anyone who lacks immunity and is making many of them very sick. Yesterday, across our state, there were over 3,500 patients in the hospital with COVID-19. More than 900 of them were battling the virus in the ICU, and almost 600 were on the ventilator. Furthermore, as of yesterday, the Ohio Hospital Association reported that statewide, about 1 in 6 patients in the hospital has COVID, and that about 1 out of 4 in the ICU is battling COVID-19. Hospitals in rural Ohio continue to see ratios that are even more troubling, with 1 in 3 patients hospitalized being COVID-19 positive, and about half of all the patients in the ICU battling COVID-19. Today, across our state, the case rate per 100,000 residents was well north of 600, and daily reported cases over 7,000. That means the figures we're seeing for COVID-19 cases, hospitalizations, and ICU admissions are all reminiscent of what we saw during our winter surge and are far from what we were seeing as recently as early July, when the number of statewide cases per 100,000 residents was all the way down to near 17. Daily reported cases were in the low hundreds, and there were about 200 Ohioans in the hospital with COVID-19.